Today's webinar is a focus on analysis in local government, and we have 4 presentations for you. I would like to warmly welcome our 4 presenters. First, Carol Brooks from the Association of Directors of Children's Services, Emily Heeds, Richmond and Wandsworth Councils, Lenny Elliott, Bristol City Council, and finally Becky Leader, Ministry of Housing, Communities and Local Government. Over to you, Carol.
Right, thank you ever so much, Natalie, and I'm delighted to be here and really interested to hear the other presentations as well. I'm going to share my slides with you now, which hopefully will work. Let's start by talking to you a little bit about who Association of Directors of Children's Services is, those who have never heard of them. So Association of Directors of Children's Services basically represents all 152 local areas of Directors of Children's Services across the country. My name's Carol Brooks. I'm the Director of Carol Brooks Associates, and I've been delighted that I've actually been commissioned by AADCS for the past 10 years to be able to undertake the safeguarding pressures research on their behalf, which is what I'm going to talk to you about today. Needless to say, it's about safeguarding children, and I'm going to talk you through what the research question is, some of the sources of data, some of the analysis that we used, and basically the richness and some of the challenges and good practice in bringing together the wide range of evidence, qualitative and quantitative, that we've looked at. We too are keen on a bit of a tweet in AADCS and myself, so there's 2 Twitter addresses there if you're up for a little bit of a tweet on this. Let's start by looking at, in terms of safeguarding pressures, it's been going, as I said, I've been doing it for 10 years on behalf of, commissioned by AADCS. All 7 phases of the research are on the website. The link is there if you haven't already had a look. And there is also a copy of the data collection form and other documents there, some of which I'll cover in the next 15 minutes. We've been collecting the data from 2007, so we now have 12 years worth of trend data. And some of the data that we have is only collected by the AADCS, it's not reported elsewhere. Some of it is the same as the Department of Education statutory returns that local authorities have to do. And when we started doing this project in the early years, we actually published national data before the DfE did. The sector was crying out for earlier data. And then basically being able to have that benchmarking and understanding how we're doing at an early stage. It's great to see that DfE are now able to publish earlier, which is brilliant, and it also makes our lives much easier in actually being able to undertake this research. So I've already mentioned in terms of the range of information that we use. We don't have a massive project to do this, a massive team to do this. We haven't got like big backroom support, graphic designers, whizzy software. It really is something that has evolved since 2010. We tried different software in Vivo, various things, Tableau, but it's done using Excel. It's done using Excel, it's done using a small project team of 3 associates, an analyst and a project officer who know data and who know the subject matter. And that is really important. And I'll talk to you a little bit about that shortly. In terms of this 7th phase, key research questions or key findings that we wanted to come up with was the changes in demand and provision of children's social care, early help and associated services. Pressures faced by local authorities up to September 2020, which is when we completed our data collection. So we're looking very much with a COVID lens for those 6 months. So looking at what data was available nationally and in local authorities to triangulate against what local authorities and what directors and assistant directors were telling us and others were telling us. So the range of data that we looked at, I've split it into 3 sources here. This is just a real small, it's a snapshot basically. We looked at, in terms of data sets and in terms of literature, there's like about 120 different evidence sources that we looked at nationally. A key one for us was looking at the ONS, at population data, mid-year estimates, and also population projections. We looked at a range of other central government data and other sort of like central body data, as it were, national data. Housing, being able to look at data around homelessness, evictions, looking at troubled families data from the MHCLG, looking at labour force survey, so DWP data about work, people in work, about benefits, and CAFCAS, looking at their data around court. So that's around sort of like court care proceedings and court proceedings for children and families. Ofsted, a good source of some of the information we drew on, looking at, for example, fostering, residential care inspections. Adoption Leadership Board speaks for itself. We looked at their adoption data. Home Office, we focused very much on the demand and change in unaccompanied asylum seeking children and refugees. So we looked at quite a lot of Home Office data and Department for Education, obviously. We also nationally looked at a range of research and literature reviews, so looking at, for example, the What Works Centre, looking at information from the Children's Commissioner, their Vulnerability Survey, Stability Index, etc., and a whole range of national policy and statutory guidance. Regionally, we collected information from the 9 regions on their internal Common Core data set of 18 social care measures. It is internal data. It is something that is very much they collect themselves for benchmarking purposes as part of their sector-led improvement in terms of the regional improvement alliances. But we did sort of work with them and very kindly got 6 quarters worth of data. So we were able to get, and sorry, notice the typo there, we didn't go up to 2002 and up to 2020 on that last line there. So we had up-to-date data to September 2020. Then we also collected our own data, as I've already said. We have always had real high returns from local authorities. So those of you who are from local authorities, massive thank you for your continued involvement, engagement and willingness to not only provide us with your numbers, but also with that the questionnaires, that qualitative information, which is so important about what's it like for you, what's going on, what's changed, why do you think that is, and what do you think is going to happen next, that direction of travel. We also did interviews with 17 directors of 17 interviews with directors of or assistant directors of children's services, which gives a lot of richness, and also 3 local authority case studies, the tip of the iceberg of which is actually in the report if you do read it, which give us that little bit of an insight of what's it like for one particular, in this case 3 particular local areas. The examples of how we, what we were looking for when we pulled different data sets together and different sort of like evidence sources together, be it qualitative or quantitative, is sort of like really headlines illustrated in this table here. So on the left-hand side, you've got the analysis, and then the right-hand side, the purpose. I'll just quickly go through this, and it'll give you a sort of like a little bit of a flavour of some of the analysis that we've carried out. We looked at ONS mid-year estimates and the numbers and put those together. So, for example, the number of referrals to children's social care, number of early help assessments, number of looked after children, number of care leavers, and that gave us a rate per 10,000 population, which was really important to be able to understand changes over time, but also be able to compare one area, one local authority to one local authority, region to region. So we're being able to look at what's different and why might it be different in that local area. And rates per 10,000 is something that's so commonly used in local areas and by DfE and other government bodies, I know. So ONS mid-year estimates were really important to us. It gave us we're able to identify trends. We looked at the qualitative questions and interviews and what people are telling us is happening in local authorities or their local areas. And we melded it together with a range of other data, such as housing, courts, providers. So we're hearing how so many more referrals for social care are where families are being evicted, where there's homelessness, where there's poverty. So again, we looked at poverty data as well. So being able to look at what people are telling us and the referral breakdown, and then looking at how does that compare with homeless data. So we're looking at using other information to gather that picture around what's happening with children at the moment. It provided that summary of what's happening, not a data-driven narrative. It wasn't statistical. It was very much about melding together these data sets to be able to look at, there's this number of agencies or these number of bodies are all saying this is an issue or what's going on here. We were putting it all together so you could actually see the impact of the homelessness data, as it were. You can see the impact of that on the social care, and we were then able to start to hypothesising about why that might be and what can we do to help prevent that. We looked at deprivation, the indices of deprivation affecting children, population change by region and different services, and produced a heat map of data from the most to least deprived. And I'm going to actually show you that on a slide in a moment. Then we also provided, and we looked at, where possible, that data analysis by region and type of authority, and we actually produced regional data packs back to each region, because one of the findings was there was disparity across the country and there were geographical variances, and we could see the reasons for those in some areas. Examples of analysis, I'm just going to really quickly go through some of these with you. I might not go through them all, they are in the report if you want to look at it in more detail. We did a basic picto chart, which was quite popular, which looked at for every 10,000 children in England there are. And the trouble with when you're putting rates in, you always end up with one like initial contacts here, second row down, which is way off your page. So what we wanted to do also is not just look at snapshots, but look at ways of correlating activity over the 12 years. So that chart bottom right, each line represents a main social care activity, as it were, sort of like from early help. Green line is referrals, section 47s, and we got round that sort of like the big range in rates, as it were, by having a secondary axis and putting the rates on there. What we can see from this is some social care activity, the demand rose at a much greater rate than others. So section 47s, which is your child protection investigations, which is the purple line, and the contacts rose at a greater rate. The other examples we gave, and I've put this one in at the top, it's a basic table really, but why this was important in terms of showing the rate and the number, and if you look to the right of the chart, you can see those percentages there. If you look at a rate, your percentage change over time does not tell you what the influence of population change has been. And some of our local authorities, they have seen over the 12 years, they've seen population change as much as 30% increase. So by looking at the percentage change in the number and the rate, we're able to see the real increase in number, and how much of that was due to population change by looking at the rate. We also wanted to look at obviously some of the sort of like the underlying categories and themes within certain child activity, for example, bottom right, child protection plans. So we just used a stack bar chart to show, for example, if you look at this, the first bar, as it were, on the left, the blue ones, what you can see is that actually neglect, you can see that over the years, the rate of child protection plans per 10,000 for neglect has increased steadily. And being able to look at how that compares to others, but being able to really focus, because we're not looking at percentage, we're actually looking at the rate, and you can see there is an increase in child protection plans for neglect, and then start to question what's that about, what's happening there, and then what do we do about it. This is the heat map that I was talking to you about, whereby again, basic Excel, we have used other packages, but for us, because of the detail and the messing about with it and the analysis we wanted to do, we just used Excel to create a heat map where you can see anonymised, but we did put the region in, the AADCS average score, the population change, and then the rate per 10,000 across various activity. We started at the top with the most deprived, and we could see that there was a correlation as you go down. Bear in mind, think that here you've got about 130 rows, and there was definitely a correlation between poverty, the higher the AADCS score, the higher your rates tended to be, but that wasn't always the case. So doing this sort of analysis actually allowed us to look at, for example, if you look at that first London one, about 8 rows down, it actually enabled to look at us in terms of that London Authority. Why have they got so many more care leavers compared to others? And why have they got such a big population increase? And if I tell you that that London Authority is one where it is a centre, a reception centre for unaccompanied asylum seekers, that actually explains that increase. So it's a way of us really quickly being able to pick out sort of like anomalies, as it were, and think about what's happening there, and looking at any correlations. We also didn't just present data and information in a numerical way. For example, what's coming out very strongly is the massive placement costs. So by doing a little table like this one at the left that said, put the costs in, but actually some of the quotes in there as well, but to give the context behind it. And this is just a really small example. So people were able to give some of that context behind some of the numbers that we put in the report. And on the left-hand side here, again, one of the big things about combining different evidence sources was the context. So what's going on here? What might the impact of different government policy or events have had on the trend data that we've got? So we created that timeline, which you might find useful, which is on the AADCS website, so that we could see the impact of, for example, welfare benefits, for example, in terms of the Adoption Act. So in terms of the different things there. So that was, you know, I can't do it justice in 15 minutes, but just really to finish more or less on components and challenges. Keep calm and cite your sources. One of the big challenges when looking at so many data sources is to be well organised, reference everything, make sure you are clear what the definitions are, and the time frames, because time frames don't always match up. Data validity, we had 5 levels of data validation, making sure we had enough time for drawing and testing hypotheses, and if we weren't happy that something was valid, if there was a query, we just omitted it. We kept it out of the analysis. Really important as well is sticking to the research question emerging key lines of inquiry. It's so easy when you've got great sources of information to get stuck in, and you get so excited you just go off on a trail and you end up down a completely different road than you should have been, and you've wasted a bit of time. And also being able to think about attribution and dead weight was really important about what could have happened, so making sure we weren't falsely aligning cause and effect. Also really important, when you read the report, it was so important it was not a statistical report. The audience is directors of children's services, policy makers, so we needed to get across a range of information that people could digest, understand, and come up with one conclusion, not lots. Tip of the iceberg in terms of the data we had a massive cutting room floor, and we could probably do 3 reports over. In fact, we've still got enough for a separate report on unaccompanied asylum seeking children, but watch this space for that one. So there were some of the challenges. What worked well is having a client, in this case AADCS, who commissioned the research, who were really clear. They were absolutely, the evidence, the findings say what it finds. You just tell us what and we had times where good project team, strong project management, getting together, inquiring minds, and we were having the discussions with AADCS and with ourselves in the project group about what could this mean, what else do we need to look at. So that teamwork and having the different, I'd call it the different types of approach and different heads, having those strong subject matter expertise and data experts was absolutely critical. In terms of the findings, I'm probably at 15 minutes now, if not beyond, so read the report. That's in a very quick nutshell, just the data side of the research that we undertook that was published in February this year.
Thank you so much for that, Carol. Turn back on my camera. There we go. Thank you so much. That was wonderful. Yeah. And yeah, definitely a lot to follow up reading back through that report, and look forward to potentially another report as well. Thank you so much. So next we have Emily. Emily, would you like to share your screen with us?
Hi, yeah, will do.
While you're doing that, I'll just remind our audience that if you do have questions for Carol or leading into Emily's talk, remember to pop them into Slido. Thank you very much. Over to you, Emily.
Okay. Yeah, thank you very much for having me today. I realised that after looking at the Eventbrite page for this event, I hadn't actually said where I was from. So sorry for keeping you in the dark until now. But yes, I'm Emily and I'm actually from Richmond and Wandsworth councils. I'm going to start by giving a bit of an introduction to how things work at Richmond and Wandsworth. So for those of you who don't know, Richmond and Wandsworth councils actually operate under a unique staffing model. So although the councils continue to be separate sovereign bodies with their own councillors, their own policies and identities, it's the same staffing group that actually serve both councils. And this means that when we're undertaking analysis, we're often doing it for two different boroughs simultaneously. So that's something to consider when we're undertaking any analysis. And I work within the council's central insight and analytics team. So we're a combination of intelligence analysts and data scientists who tend to work on cross-cutting projects. So we work across directorates and we bring lots of different data sources together with the aim of providing a more complete answer to questions that require an analytical input. When I first joined the councils, we were actually known as the business intelligence team. And I think the change in the team name has sort of reflected the push over the last 3 years to move towards more in-depth analysis and analytics. And I think there's been certain factors that have helped us achieve this. And that's through things like the data science apprenticeship that the councils launched towards the end of 2019, something I'm actually lucky enough to be part of, and the data and analytics strategy that we're currently in the process of implementing. The Insight and Analytics team actually sit within the wider policy, performance, analysis and communications team. And this means we're able to develop really close working relationships with those teams around us. And we can make sure that analysis is contributing towards organisational priorities. And hopefully that's something that you'll see throughout the presentation. And just something to highlight about the analyses that I'm going to be talking about, they were performed within the last year. So alongside the support the team was giving to the local COVID-19 response, and as ever under tight deadlines too. So there's lots of analysis projects underway at Richmond and Wandsworth, but I'm going to be focusing on how we've used analysis to deliver climate change initiatives. Climate change being a big priority for both councils, having declared climate emergencies in 2019. And if you look at the corporate objectives for both councils, you'll see that climate change and the environment is reflected in those too. So the first of those initiatives is the Green Homes Grant, more specifically the Local Authority Delivery Scheme. So this involved bidding for funding from the government in order to deliver energy efficient improvement to homes across both boroughs. The second is the Solar Together scheme. So that is effectively a group buying scheme that results in more affordable solar panels for residents. And finally, looking at a local food waste behaviour change campaign in Richmond. And this was all about trying to encourage more food waste recycling in the borough. So starting with the Green Homes Grant, in July 2020, the Chancellor announced a £2 billion Green Homes Grant to upgrade homes across England. And under this, £500 million was to be allocated to local authorities through the Local Authority Delivery Scheme to improve energy efficiency, specifically of low-income homes. So the first step of this basically was applying for the funding, and there was tight deadlines around putting the bid together. The policy team we were working with essentially had 2 to 3 weeks to submit the bid. So what they needed from me was an estimate of how many homes in both Richmond and Wandsworth would be eligible for the funding. In terms of eligibility criteria, the homes needed to be amongst the poorest performing when it came to energy efficiency. So the initial requirements for those with an energy performance certificate on their homes rated E, F or G. So those are the three lowest ratings. But households also needed to meet the income criteria, which was for the annual household income to be less than or equal to £30,000. In terms of the energy criteria, the Ministry of Housing, Community and Local Government have an online database that actually stores EPC records. So with some data preparation to ensure that only the latest entry for a property was used, this is what we use to determine whether the household met the energy criteria or not. There was also some limitations to the dataset because not every property has an EPC, and that's something that we address later on in the analysis. So we had the energy criteria sorted, but a data source for income criteria is much more challenging to find. Household level information on income isn't easy to come by. However, the council had recently acquired postcode level acorn population segmentation data from a company called CACI. So within this data set, there was a household income variable that we used to provide an indication of household income at the postcode level. So what we did then was we built a data model in Power BI using the postcode to link these two data sets together in order to estimate the number of homes eligible. And we chose Power BI as our colleagues working on climate change had already started some similar work with data science students from a local university within Power BI. So this meant we could hit the ground running with a software that we already had the skills in at the time. And by acting quickly, we were actually 2 of 55 successful bids for the first phase of funding. And after a second wave of bidding, where the energy criteria were expanded slightly, we had successful bids exceeding £1 million in each borough, which is really good. So the second step, once we'd achieved the funding, was to promote the scheme by targeting communications to those homes that were more likely to be eligible. The communications budget for the project wouldn't support blanket mail-outs, and we knew from the eligibility criteria that only a small proportion of our residents were likely to be eligible anyway, so blanket mail-out would be a poor use of resources. So the analysis needed to be more specific than in the first stage, and whilst being more specific, it also needed to still capture everybody who might be in need, or at least, try and capture as many people as we could that were in need. As mentioned previously, there wasn't a one-stop shop source we could use to identify those who met the income criteria. So we used a combination of private, partner and public sources, ranging from a list of our own residents who were in receipt of benefits, all the way to those areas that were more deprived in terms of income when it came to from the English indices of deprivation. On the energy side, our partners Retrofit Works, who were helping to deliver the Green Homes grant in Richmond and Wandsworth, had also done some work in modelling energy rating of homes without an EPC, so without an energy performance certificate. So we brought this in alongside the EPC database on the energy criteria side to sort of make sure we were capturing or making up for those homes that didn't have an EPC as well. So in terms of bringing all of those data sets together, unfortunately, there wasn't a unique identifier common to all of them. So some did have the national unique property reference number available. So we used this where we could. But for the energy data sets in particular, they didn't have that unique reference. All we had to match those data sets was the addresses. So we employed a technique known as fuzzy matching there. And as we'd started the analysis for the bid in Power BI, we took advantage of its inbuilt fuzzy matching capability to do this, to perform the matching on the addresses. But as time and more phases of the Green Homes grant were introduced, and personally my skills were progressing on the data science apprenticeship, I was able to write the code to be able to do that in the software R. And that allowed more flexibility actually, because you could change the technique that was used and change the parameters that were set. So if we just have a look at this graphic here, I don't think any of these addresses would actually have met the criteria for the Green Homes grant, but hopefully it demonstrates how addresses can be different in different data sets. So, I mean, here we've got abbreviated street, here it's spelled out in full, but with fuzzy matching, those have been paired because they've been assessed as being fairly similar. And this column on the right is actually a measure of similarity. So at the top, we've got the most similar towards the bottom, which are the least similar. And I don't know if anybody's noticed, but we sometimes were getting this issue with matching similar house numbers. And they are different addresses there. We wouldn't want them to be matched. So what we did is we later introduced some code to refine those matches and eliminate any matches that didn't have a matching household number and postcode. So it was a combination of fuzzy matching and then exact matching, really. So for the initial mail out, we found our bid was successful on the last day of September, and I think we were actually sending letters out towards the end of October. So again, very tight turnaround. There've been several mail outs since to encompass those eligible for other phases of the Green Homes grant. And despite some hesitancy about having work done during the pandemic, the number of applications we've received is actually approaching our target number of installations, which is good. So the final component of analysis done for the Green Homes grant was actually some experimental regression modelling. And this occurred alongside the targeting communications work that we had done before we knew retrofit works had made efforts to model energy performance of homes without an EPC. And this crossed over largely with the data science apprenticeship I was doing and actually became one of the projects that I submitted as part of that apprenticeship. So my aim was to do something very similar to retrofit works and see how well certain variables in the EPC database explained the energy efficiency score, and that score is effectively what's converted into the A to G rating. So we chose variables that we knew existed elsewhere, such as property type, property size, and when the property was built. Because if the model ended up being successful, then it meant that we could get that data from those other sources. So we built and trained the linear regression model in R using these variables, but it turned out that they only actually explained about 30% of the variability in the data. And you can see on the right-hand side how the predicted score compares to the real score. And in some of those cases, it's better than others. Adding more variables to the model would obviously improve the accuracy, but I think we've done the preliminary work now, and it's at a stage where we can pick it back up again if we need to refine it in the future for any further work. So the second climate change initiative I'm going to talk about is a Solar Together scheme. And as I mentioned before, this is a group buying scheme for which the councils have partnered with a company called iChooser to bring households across London together to get high quality solar panels and battery storage at a competitive price. So for this analysis, the policy team needed a list of addresses in both Richmond and Wandsworth that were more likely to take up the scheme. And in this instance, they needed to be able to pay homeowners with rights to roof access. So our first step here was to look at indicators again in the ACORN population segmentation data, and this time at household level, to identify those types that were more likely to have savings to be able to pay for the solar panels and more likely to be homeowners of detached, semi-detached, terrace housing, those kinds of properties, as these would have the access and permissions for their own roofs, basically. So after we'd identified homes reflecting those criteria, the approach we took was probably swayed by my background as a geospatial analyst, but we used geographical information systems to overlay the ACORN data with other relevant data sources. So we overlaid the ACORN type selected with listed buildings and conservation areas, and that was to flag those that might encounter additional considerations when planning for the installation of solar panels. What we did is also was to perform image classification on the UCL GLA solar opportunities map in order to bring that information on solar potential into our overlay analysis. So we have an idea of where installation was more worthwhile and uptake was more likely. So as a result of those targeted mail-outs, Richmond has actually currently got the highest uptake of the Solar Together scheme in London. I think Wandsworth's got the 5th highest, so it's looking quite positive. So moving on to the final climate change initiative, which is food waste analysis, which was done to inform a behaviour change campaign in Richmond to encourage more food waste recycling in the borough. This project began with a waste composition analysis done by the West London Waste Authority, and that actually revealed that 30% of the waste in Richmond that's thrown into people's ordinary black bins was food waste. And that's quite surprising, as Richmond is a borough lucky enough to have a food recycling service. The West London Waste Authority had provided a breakdown of their waste composition by acorn type. And as we had the data, as you've seen before in the previous examples, I was tasked to further investigate the lifestyle indicators within that data to determine what might be having an impact on those food waste behaviours. Well, one of the interesting findings from bringing these two data sources together was that of the 4 main acorn types in the borough, those with the smallest average household income were actually throwing the most food away. So when it came to putting together a food waste campaign, this intelligence might suggest that money isn't a huge motivator for these types of people, or perhaps the savings to be made from not throwing food away is something to be highlighted. So that's the sort of intelligence that we could derive from that. So with the intelligence gleaned from that initial analysis, the communications team who I was working with on this project launched a questionnaire to determine whether there was any borough-specific food waste behaviours. And I was lucky enough to help with that analysis too. So one of the key findings from the questionnaire was that we found only 1/5 of people understood what the council does with their food waste when it's recycled. So it's not surprising when the food waste campaign was put together, this advert on the right-hand side here, this part of the campaign, it was one of the top ads in terms of people interacting with it. So those 2 steps of analysis help to inform the ongoing behaviour change campaign. And yeah, as I said, these are examples of the sort of communications that are occurring at the moment. So both through programmatic advertising and social media posts. Still in the very early stages. I think the campaign has been live for about 3 weeks. So we'll keep monitoring that and how successful it is. So I just wanted to end by summarising sort of what has shaped the analysis that I've spoken about and what we'll continue to going forward at Richmond and Wandsworth. So I think one of the key factors there is definitely our ambition to improve the services we provide by delivering better insight through different approaches and more complex analysis. I think by moving towards analytics and developing our data maturity, we've definitely seen improvements in choosing the most appropriate analysis to get the best result for our residents, and that's within the parameters that are established at the project level, so timelines and other pressures. I also think we've been able to make the progress that we have because of the efforts made to recruit and upskill the workforce. And hopefully the analysis showcased demonstrate the value of looking beyond obvious sources of data and linking internal data with other data sources to arrive at a more complete answer. Something else I learned from the project that I've worked on and I've talked about today is by taking time to explain what can be done and what has been done to the teams you're working with really helps to improve data literacy throughout the organisation and leads to more productive relationships later on in the future when you're working on other projects, because the people you're working with know what questions to ask you then. And finally, just wanted to say that all of these things for Richmond and Wandsworth have enabled analysis-led projects that are helping to deliver services more efficiently and effectively for our residents, basically. So, yeah, and some acknowledgements there.
Thank you very much, Emily. That was really interesting. 3 really interesting initiatives going on. Yeah, awesome work. Okay, continuing on. So next we have Lenny from the Bristol City Council. So if I get you to share your screen now, and again, I'll remind our audience that we have got some questions in Slido. You can put more there if they've sprung to mind, or you can also vote for the ones that are there. When we get to the end, I will ask the most popular questions first. Yeah, so over to you, Lenny. Thank you.
Thanks very much. My name's Lenny Elliott. I'm one of the information analysts working for Bristol City Council, and I specialise in producing ClickSense dashboards for children's social care. Over the last few years, our team has been focused on modernising our reporting suite, so reducing labour-intensive manual work like collating data on spreadsheets and manually producing weekly and monthly reports. And we're focused instead on automating processes and developing self-serve reporting, which is refreshed every day with the latest data. We began developing reporting in ClickSense around 3 years ago. Prior to this, we used SSRS to produce some simple automated reports for about 2 years. And then previously, before that, we used business objects to generate snapshots of data on a weekly or monthly basis, and these were sent to the teams. The main advantage of moving our reporting into ClickSense was for children's social care to have instant access to interactive self-serve dashboards, which allow the user to choose how to explore the data. The apps can be dynamically filtered so that users can find answers to their own questions, for example, to view upcoming tasks for a particular team, or to compare performance and outcomes across different service areas. The data is entered into a case management system, LCS, by staff in children's social care. This is extracted in an overnight process and stored in a data warehouse. We've set up our own automated overnight processes to transform this data using SQL and load it into our various reports on SSRS and ClickSense. We've also created stored procedures to populate local tables overnight with some of the data required for our apps. This reduces the need to apply the same transformations in multiple places, and it improves consistency between our reports. We also load in some external files into the data warehouse, for example, population data and national published figures, so that our apps can benchmark our current figures against local and national data. We currently have 21 published Click apps for children's social care. They cover a wide range of information, but they can be grouped into 3 categories. There's reporting on statutory data sets, for example, the Ofsted Annex A and statutory returns to government. There's also apps focused on particular themes like children in need, children at risk of exploitation, young people leaving care. And then there's apps that provide an overview across the entire service, like the Caseload and Throughput app and the Case Auditing app. Today I'm going to be showing you the first and still the most popular of our apps, which are based around the Ofsted Annex A dataset. So the Ofsted Annex A is a statutory dataset of 10 lists of data that provides an overview of the service for Ofsted inspections. Prior to developing this app, visualisations of the Ofsted Annex A data were only available to the service as a static PDF and a spreadsheet, which our team produced monthly using manual processes. Whereas the Annex A Click app was designed to automatically update on a daily basis with the latest data, and also has the additional benefits of interactive filtering. So managers can use this app to drill down from high-level performance summary, as we see here, to detailed dashboards and filterable child-level list pages. Here on the homepage of the app, we can see an overview of the headline figures from each of the 10 lists of the Annex A. We've also included benchmarking figures alongside the current data from LCS, so our current performance can be compared with our local authority's latest published figures, as well as local and national averages. So for example, here we have our current rate per 10,000 children. And we can see the current figures in green benchmarked against our latest published figures for 2019-20. If I scroll down this page, we can see some of our key performance indicators from the Ofsted Annex A data. For example, we have our re-referral rate is currently 21%. So this is where a child has been referred to our service, but it's not their first referral to our service. They've been referred before within the previous 12 months. And we can see that information benchmarked against our latest published figure, which was 28% in 2019-20. Or here we have assessment timeliness, which we can see we're currently at 89%, and that's an improvement on the 84% in the latest published figures. So having these data sets included together and automatically refreshing means that this data is really clear to see what the trend has been since our latest published figures. Clicking on any of these KPIs will take us through to a dashboard of charts specifically about that data. So if I click on the rate of referrals, this should open the referrals dashboard. Now all of our apps are built to a template, so it helps achieve a consistent approach to the reports for our users to navigate. So at the top of each page, we've got a menu bar. This one includes links to dashboards for each of the Annex A lists, and also list pages which detail this information at a child level, and links to related apps, and also a help and definitions page. We include this on each of our apps to give a bit more information about what the app includes, where the data is coming from, how to use the app, and also some definitions if there are any key measures or unique terms used within the app. In this example, we're talking about an Ofsted data set, so this app includes a link to the latest Ofsted guidance. If I return to the referrals dashboards, we can see that all of these charts on this page are interactive and filterable. So that's one of the key advantages to using software like ClickSense, is that we can drill into the data. So we can see the overall number of referrals in the last 6 months at the top of the page. If we wanted to narrow this down a little bit, let's just say we were interested in referrals that came from the police. We could click on police on the source of referral chart. All of the charts within the page and actually within the entire app have now been updated. So the data is only focused on referrals from the police. If I make some other selections within this chart, we can see that all of the charts around it are updating based on just the data that we've selected. So if I leave this selected for the police, let's say that we were interested in a particular demographic of children. So let's add an age range using the age of child chart. If I scroll down the page, we can also see we have information here about those re-referrals, children who've been referred to us more than once in 12 months. So if we were just interested in looking at those re-referrals, I could select those in that chart. We can see that the overall total number that we have selected reflects the selections we've made. So we now have 59 referrals in the last 6 months that meet the criteria, which we can always see here at the top of the screen. So referrals from the police within the age range we've selected who've had previous referrals. If the service wanted to know, well, who are these children? What were these referrals? You can always open the list page to get a full list of the data behind these charts. So if I open the referrals list, and this is a redacted list, so it would normally have more information here about the child and who's working with them, but we can see the service and team, and we'd have the details of the child here, and we can see the date of the referral. Now this list is dynamically filtered depending on our selections that we've already made in the app, and you can see that the selections are still applied at the top of the page. If I clear the selections, we're now viewing a list of all of the referrals in the last 6 months. One of the advantages of using these tables within ClickSense is that all of the columns that we add to the table can also be used as filters. So if I click on current service, and let's imagine that we were the service manager for a particular service and we wanted just a list of that service's data. So I'm going to select East Central, and let's have a look at our referrals to East Central service area in the last 6 months. Again, we can see the number of them at the top, and here are a list of the referrals. If I go back to the referrals dashboard, we're now looking at a personalised dashboard just for the East Central service area. So we can see the details of the children, the source of the referrals and the outcomes. We can even see that information by team, and we could even drill this down further and look at this information at a worker level. And there's also benchmarking included here. So for example, our rate of re-referrals, our 21%, that's the information taken that's loaded in overnight from LCS in this green bar here. So that's our up-to-date data, and it's benchmarked directly next to our data that's come in from one of those local tables where we've loaded in the previous published figures. So we're comparing this in the same chart, our current data, to the percentage of re-referrals for Bristol and our statistical neighbours and the average for England. So it's very easy to see where our data is now and benchmark it with the latest published figures. Now to take you behind the scenes a little bit and look at how this app works, I'm going to open the data load editor. So this is behind the scenes of the data that is in that app. This is using a language called ClickScript, which is unique to ClickSense. But you can see that we've created a table here called Annex A, and we've loaded some fields, and we're using SQL to select from a local table. So this is one of the local tables that we've created in our data warehouse that refreshes overnight every night automatically, and it contains just the information that is needed to populate Annex A List 1, which happens to be the list of contacts. Then each of these sections here is the same process again, but for each of the different Annex A lists. So we load in the data for each of the Annex A lists out of our local table, which is already run overnight with the latest data. Once this app has then refreshed with that new data that's come in from the local table, that happens overnight, and the data is stored to a small file called a QVD, as a ClickView data file. If I open this folder here, we can see the Annex A QVD. So that is all of the data within this app that we're saving every day automatically into this file, which is specifically optimized for ClickSense. The advantage of that is that we can then load from that data into other apps, and it's more efficient than connecting back to the same data source and running through the same transformations again to the data. We can just load the data from one app and then share it amongst other apps. You can also see here that we've got monthly snapshots of this data. So again, there's an automated process where once a month the app takes not only the daily snapshot of the data, but it also saves a copy of it as that month's snapshot. So here we've built a library of Annex A snapshots over the last 3 years, and these can be used to build a history, which we can use in other apps. So to show you an example of an app that loads from this data that we've saved into that QVD, here is the Annex A error reporting app. So every day when the Annex A app has refreshed, this app is triggered to automatically reload the same data out of the QVD and populate this app, which contains errors and omissions. So this was after we'd produced the Annex A Click app, which was our first Click app. We then spoke to the service about what they needed, and they wanted to know how to improve that data. And instead of having to drill down into lots of charts in different areas of the app, let's gather it all together so that there's a dashboard for areas for potential improvement. So these are items that are not recorded on children's records, so we can see health assessments that are showing as overdue, children who haven't had their ethnicity recorded on the system yet, children in need who haven't had a visit recorded on the system. We can see that information at a service and team level, and selecting a service will drill down to a team. So a team could select their own team name and then go to the full list page and gain a list of all of that data, which they could then work through to correct on LCS, the case management system. Again, this is redacted, so we normally have a bit more information, but we can see the service and team and the type of error, the location of the error, so the child's records, and a bit more information. So, for example, here, a care leaver not in touch with the local authority, we can see when they were last in touch, or a health assessment overdue, and we're picking up the information of when their last health assessment was. If I clear these filters, let's have a look at this over the months. So here we have a trend over the last 12 months. Now this is using the QVD snapshots that I showed you earlier. So each one of these points in time is a snapshot of how this data looked on that specific date. We've built the history this way because we're looking at omissions in data, things that weren't recorded. A lot of these will have subsequently been recorded to correct the error. So by taking a snapshot of the data, we're able to see exactly how the data looked on that date instead of recalculating a history based on today's data. At the moment, all of the different types of errors we're looking for in this app are overlaid on this chart. But if we wanted to focus in on a specific error, let's have a look at children without their ethnicity recorded on the system. We can use this error type selector at the top of the page. Or let's have a look at children in needs who haven't had a visit recorded on the system. So we can see the trend over time in correcting these errors and identify potential areas for improvement or areas that are improving. After producing this app, we then went on to produce the Annex A history app. Now this is a recalculated history based on the data in the data warehouse today. And this is automatically pulling through the last 12 months worth of the data for each of the Ofsted Annex A lists to give us that trend at a glance. So this is looking at the overall number of children on each of these lists. And then if I go to the referrals page, we can actually see the trends in referrals over time. So referrals in the last 6 months, our percentage of re-referrals over time, referrals that led to no further action, or referrals by source. And there's a similar page for each of the Annex A lists of data. So prior to having this app developed, if the service wanted to see the trend in this data, it would involve managers opening a spreadsheet or a static PDF of the data that we produce once a month and comparing this month's data with last month's data manually. So by adding this into Click, we've created something where this information is very visible and easy to see at a glance. We continue to develop new and updated Click apps based on feedback from the service. New app requests are added to a development list to be prioritised by the Director for Children's Social Care. And we work closely with senior managers and staff that are going to be using the apps to form a project planning group for each new app. The group works together to agree a detailed project plan, keeping in touch throughout the app development to answer any questions and provide feedback. And sometimes the data that the service requires is not recorded in a way that's reportable. So we often include our LCS team at the project planning stage in case any forms in the case management system might need updating to enable us to report from them. Once an app is complete, we peer review it internally within the team, and we publish it for testing by the project planning group to make sure that it's going to meet the needs of the service. We provide ClickSense access to all managers and all business support roles across the service, and our team provides support to anyone using the Click apps. This began with an initial series of rollout visits to demonstrate the first apps to the teams, and it continues with virtual Click drop-in sessions for advice and training. We've also created user guides on how to make the most of the features of the apps, and we encourage the teams to contact us with any feedback. The outcome of this work is that managers in children's social care have access to rich and detailed information about their service, which is always up to date. The reduction of manual processes means that our time within the team is also used more effectively, producing new reporting products and adding new features. We've designed the dashboards to be as consistent and user-friendly as possible, so that users don't have to be data experts to gain insights from them. I'll leave you with some of the quotes that we've had about the Click apps from managers in children's social care. So having access to the data at our fingertips has allowed us to manage and improve our key performance indicators across the service. The real-time data, easy navigation and visual format supports effective management of key performance areas. I now have the data that I need to work effectively with multi-agency safeguarding partners, providing constructive feedback, challenge and support. That's all that I had time for today, so I'll hand back to Natalie, and thank you very much for having me here today.
Thank you so much. That was wonderful, and someone just posted on Slido, excellent stuff, Bristol. So awesome app. Great to see it in working order. So over to Becky. I think Emma's going to share your slides in a minute. while we're doing that, there is a few questions on Slido, so feel free to vote for them, and once Becky's finished, we will follow up with those questions. So there are the slides on screen now. Becky, I'll pass over to you.
Thank you. Sorry, a slight technical hitch earlier today means I can't share my own slides. But I'm Becky Leader, Data Transformation Lead for the Supporting Families team at the Ministry of Housing, Communities and Local Government. And we were previously the Troubled Families team, and we were renamed at the beginning of this financial year. So my first slide has a quote on it, which is a Simon Sinek quote, which I shamelessly stole from Dorset, who use it to describe their approach to data maturity. But I feel like it perfectly captures our national approach to data maturity, which I'm going to outline today. And the quote is, dream big, start small, but most of all, start. And hopefully that will come clear as we go through. So the Supporting Families team has a strong ambition to help all local early help partnerships to improve their data maturity and provide a consistent model of maturity, a standard at which we can all aim and innovate around. This aim for consistency does mean that I have to apologise to some of the Supporting Families analysts on the call. They'll be really familiar with today's content. So if the numbers start dropping now, I will try not to take that personally, but I might mention it later. So we realise that this model, as part of our, we put this out this model as part of our early help system guide, which is available online if you want to Google it. And we can see strong data models, so because we see strong data models as the infrastructure to facilitate the amazing work that takes place across local partnerships to support and work with families and achieve outcomes and prevent issues from escalating. There are some high-level components of our mature data model, which are bringing together the data held by individual partners, so that's by education, police, health, DWP, and that's to understand all the issues and outcomes experienced by families. We want to quantify the qualitative information that we hold. Whilst qualitative information is amazing and really important to this process, there's also a part where we need to get that qualitative information into quantifiable view so that we can understand what our workers are working with. So whether that's undiagnosed mental or physical health conditions, behaviour at school and the community, we need to make sure that we can see how many cases have got that in, how many families are experiencing that, how many workers are dealing with those problems. So it's about trying to work to get that quantified information in order to be able to report on it. Consistent and visible case management across the partnership. So having joint case management systems where all lead practitioners record on a single system and making sure that workers can have access to the data that we're gathering in order to enhance their assessments and make sure they're making full and holistic family assessments. Using data to inform resourcing and decision making at a strategic level. So providing these data to managers to help them to decide what they need to commission, whether it's mental health support or substance misuse support or anything else. And using the data to understand the needs of the wider population, employing analytics to understand trigger factors for serious issues and escalation, being able to predict risk and therefore being able to support families to prevent issues from escalating. Next slide, please. Sorry, I forgot to do that before. So we each year ask local authorities to complete a survey so that we can understand how they're using data and how they're delivering against those elements of data maturity. Helps us to support them to develop data and to put right support packages in place, but also for us work with other government departments to develop policy so that we can help develop that data infrastructure at a national level as well. So it has two prong benefits. Survey asks a really long list of questions about data sharing amongst the partnership, what systems are used, both case management and data systems, data visualizations that are employed. Well, you've heard a lot about Power BI today, and that's one of the ones we're often asking about. The reporting that's done from case management systems, but also on a wider scale to inform commissioning decisions, strategic decisions, local operational reporting, and the use of analytics. And as part of the survey, we ask local authorities to self-assess their level of data maturity against all the elements in the previous slide. So as you can see from this graph, the majority of authorities are falling within the basic model, which is where they're using Excel to match a few data sets, usually closed data sets. By that, I mean data that is specifically provided on the cohort that the authority or the partnership's working with, rather than being on the whole population. They also ask about, what do you know about this family, about sorry, I've completely lost my train of thought there. They ask whether you are playing that back to the partners. If your partners are recording on the system, are you recording your outcomes in a quantified way? So as we go up the models, we can see areas who are more advanced and receiving more data sets. They tend to have the open data on population level. They're matching them in a more automated way. They're able to play the data back to workers, and they've got partners recording in their case management systems. They're also using these data to conduct analytics to understand the needs of the whole population and prevent issues from escalating. The power of using these more advanced models is demonstrated by the following examples. And this is probably the best slide, I think, because it's showing what local authorities can do with amazing data. So next slide, please. So at the outset of the COVID-19 pandemic, first area that I'm going to give you an example of is Barking and Dagenham. They use their OneView data hub to bring together data from a range of sources to identify over 2,000 families at risk. They undertook proactive contact with them, and that could be through a food package to an offer of intensive support, and it would depend on the level of vulnerability identified what route they took. It also resulted in a spectrum of outcomes, so including families who were receiving support packages, or they became engaged in direct family support or an intervention, or they received tenancy sustainment support. Bristol, so you've just heard from Lenny and seen the app on ClickSense, which is amazing. I'm going to focus on another of the apps on ClickSense, which is based on their Insight families and their inbuilt Think Family database. This brings together data to identify a range of different issues and factors, and this is where they also are able to now use regression analysis to look at trigger factors that might suggest that a child is vulnerable to a certain risk or issue. So, for example, they started off by using trigger factors for child sexual exploitation. They tested whether they would have known about the issue arising of child sexual exploitation later, and found that they would have known beforehand in 8 out of 12 cases. And they've now built this into their system, so it will alert family workers that a child in one of the families they're working with is at risk. So it's a fantastic piece of targeted analytics, which really interesting piece of work, which thanks to Lenny for sort of explaining all the backgrounds of what Bristol's approach is. So Liverpool used their Supporting Families database and expanded it to include health under the COVID provision for sharing health data, and used that health data to match to other issues to create a vulnerability index of individuals and families to prioritise food and prescription deliveries. And they also prioritise care packages. Liverpool is now considering how they can use these data to identify people at risk and develop intervention and mitigation strategies for future arising issues. So these are just some small examples of how a mature data system provides a strong infrastructure to support families, and that's why I chose that graphic there, which I've inexpertly put across the slide. But it's just sort of showing that data is not, it's a part of an infrastructure to help families and help communities, rather than being, you know, an entity on its own or something that's quite separate. It is part of the practice and part of that process. So having seen these amazing models, I think a lot of people ask, how do we get there? So next slide, please. Many partnerships have really strong ambitions to do analytics in similar ways to Bristol, Liverpool and Barking Dagenham. They want to do needs analysis and targeted analytics to understand risk and use their needs analysis to look at resourcing or perhaps prevent issues from escalating or catch them really early. But like this pyramid, you need to build a really strong base to reach the pinnacle at the top, and the pinnacle being those kind of analytics. Without a strong data model, any analytics will result in unreliable findings, and it'll be an exercise in empty space. It'll be full of frustration and despair. It will deliver, you know, it might deliver findings, but whether you're able to trust those findings would be really hard to know. So really you need to start by building a really solid foundation in your data modelling in order to get to the point where you can conduct the fun part, the good part, the interesting part, the part that really helps the analytics. So once you've done that, you've built that strong base, you create freedom, you create efficiencies, and you create a space to innovate and to create analytics that will be reliable and that you can trust and that you can work with your practice and your families. So I have stuck with my pyramid analogy, and I talk about building blocks, and that's if you go to the next slide, please. I'm going to talk through some of the things that I think are the building blocks to creating a good foundation to building up to predictive analytics. And you know, this is just a set of what I think are the basic foundations, but this should still be about innovating on this. You know, there's lots of different ways to approach things like this. You can still do things differently. This isn't prescriptive. So we in the Supported Families team have set up a number of data maturity milestones that we're asking our programme to achieve this year. And one of those is to establish a data governance board. So strong data governance has the opportunity to create shared practice standards for recording data. It's able to consider shared systems, develop data sharing agreements amongst partners. And it's really important that any board like this also includes information governance colleagues. They're fed back to us that the earlier that they're involved in this process, the more they can help and develop and guide developing data sharing agreements. So it's really important that they're involved in that process as well. I harp on about this, but quantifying the qualitative, again, I would suggest that qualitative data is probably, you know, the most amazing data and so important, but quantifying is also really important, in particularly around understanding issues that your family workers are working with, that your families are experiencing. It's often the most important where systemic data are not available, so the behaviour issues, perhaps the undiagnosed issues. What quantifying gives us visibility. We understand what's being experienced across our whole partnership. We know what our family workers are working on, and it means that senior management teams are able to make efficient commissioning and resourcing decisions because they know exactly that 70% of their families that are working with have mental health issues, for example. It also helps central governments better understand the needs across the country and develop policies to support partnerships and to support them to support. How many more times you can say the word support in one sentence? To support families to address the needs as well. And it's really important that once you quantify things that you can report on them, and that you understand that you're able to not just rely on built-in sets of reporting, but you can develop your own, and that you can access data warehouses or universities if you've still got those, and define your own reports so that you can respond to intelligence needs really quickly and in an agile way, so that you're flexible in your reporting. It's really important. It's really key to this. This brings us on to the importance of having a data warehouse, data lake. It's where you can bring together all your sources of data and set matching protocols and configurations. You heard about Emily talking about fuzzy matching earlier as well. You can do all of this in here and automate it. You can also test it, make sure it's as accurate as possible and that it complies with legislation and that you've got defensible positions for how you're using data and you're really clear on that. It means the data feeds, whether they're Excel CSV feeds or automatic feeds or APIs, they can be automatically pulled into systems and matched, providing an overview of the needs of the family in the local area and so helping local services to respond. I will say testing and building analysis, it always takes longer than expected. We always think once we've got all these foundations in place, we're ready to go. Make sure you're sense checking your analysis, that you've got good safeguards in place to test for accuracy. Try more than one method. There will always be more than one method. And ensure that analysts have had the good and relevant statistical analysis training so that they understand the results of these. Because a lot of packages will say that they'll do the analytical work for you, but it's understanding what you're getting out the other end, and that training is key to that. And also think, it was mentioned earlier about data visualizations. I think Carol alluded to how do you report on these data to make them accessible, and making data accessible and understandable is just, I don't know if that's the most important thing, because once you've done all this work, if no one understands it or wants to engage with it, it kind of defeats the object. So making sure that you've done that is really important, and that you're talking to different audiences. You might want to translate it into words. I think Bristol took that approach. I think Carol was saying earlier she took that approach as well. You might not want it as a set of figures. You might not want to take that sort of, I think it's Playfair's charts, and use charts throughout your process. You might want to turn it into, different types of visualization. Really think about it and really consult the people that are in your audience, because they're the ones that need to be able to understand it. You need to understand what level of granularity it needs to be reported at, how often, whether it be at unit level, is it operational, is it strategic? That's a really important part of the process. And consultation on the whole is just absolutely key. Your workforce should be involved in this. Your family should be involved in this. You should be able to, explain what you're doing to the families, the workers, and make sure everyone is able to understand why it's important and what it provides them with, and that it is complementing professional judgment, not imposing on it or changing professional judgment. That's really important. I'm going to end on this last slide. Obviously I'm going to end on the last slide, but I'm going to end a bit sooner because I can see the time, and I know there's questions coming in for people. But we as a national team are working really hard to support local partnerships to build their analytical capability. We have an analyst community online now where they're sharing ideas and practice. We've played back survey results. We do a series of digital showcases. So if anyone wants to hear any more about that, I'm really happy to have a chat outside of here. But thanks for listening. I know I wasn't as well spoken as some of our other speakers, but hopefully that was useful for you all.
That was wonderful. Thank you, Becky. I really like that quote from the start as well. I might steal it and credit you with it from now on. Wonderful. Thank you so much to all of our speakers. I think we can all agree they did a great job, and today's been a really interesting session. It's not over. We have quite a few questions in Slido, so if you haven't had a look, pop over and have a look now. You can vote for your favourite questions. I will be taking the most popular first, and I have roughly been trying to record who they were for as they came in. So the top one is for Emily, and it is Lee asking if you could share your fuzzy matching code / method for Power BI. Have you already shared that, or are you able to share it?
It's not something I've shared yet, no, but and the code itself I think is quite specific for what we were doing at the time, but what I can do is I'll put some links to a guide how to do fuzzy matching in Power BI. I'll put a link in the chat for that, and also share the package that I was using in R to do the fuzzy matching in R as well. So that was a package called Fuzzy Join, and that has the functions, different functions you can use in there, because yeah, depending on what you're trying to do, that will influence like what parameters you set and that kind of thing. So sharing the code for our specific uses probably wouldn't be that useful, but I will share the package that we used.
Wonderful, thank you. Yeah, any guidance on that is much appreciated. As Billy just said, Lenny, that was awesome. Well done. I think we were all pretty impressed by that app. It was amazing. The next question was quite an early one, and I think it was aimed at Carol, but you might all have a opinion on this one, but we'll start with Carol. So the question was, what would be one of the biggest change you would like to see with how central government work with local government and external organisations?
Thanks, Natalie, and thanks again. That's a really good question, whoever asked it. There are discussions going on, obviously, and there have been. I've been in public sector far too long than I'm going to admit. But it seems we've been having same conversations for for ages in terms of being able to have better analysis from, for example, the DfE. I'm so excited with the information the Supporting Families were sharing and their support of supporting local authorities. And I do think back at the first wave of the troubled families really did help to support local authorities to empower them to get some of their data together. So, you know, kudos to Troubled Families the Wave 1-1. So kudos to them. I think over the years, DfE, they have, as I said before, they are publishing earlier, but we still have a long way to go with central government data. Now, I know there's somebody on from the DfE, and a big plea here. Some central government data is unusable. If we're looking at looked after children numbers, for example, in local government, we can't use it. In the AADCS research, we couldn't use it because it's rounded up to the nearest 5. And if numbers are small, they're suppressed. So I can't get the robustness that I need from DfE data. So we have to collect it again from local authorities. Now, if the DfE did the level of analysis that local authorities needed to be an AADCS needed to be able to look at what I was talking about in terms of understanding some of the trends, the sort of like some of able to combine and compare different data sets and do that triangulation, then I think it would make everybody in local government a lot easier. And we're still not seeing, I would say we're still not seeing the level of analysis and the level of detail we need, especially certainly from health. Health data is generally outdated, and it's, unless you're actually in, it's quite hard to get the level of data that you need. So I still think, thinking across local area partnerships, we've got a way to go to combine and make use of data, and it's improved, but we're not there yet. And central government, I'll be really honest, there's some fab things. Stuff the ONS is doing is brilliant. DfE have moved away from statistical first releases to a more interactive, exploratory sort of like data set, which is great, but we've got a long way to go yet.
Thank you very much. Okay, the next one was for Leonie. So, how well does ClickSense facilitate more statistical / data insight analysis?
I would say ClickSense is great for data exploration straight out of the box. It enables us to cross-filter and to explore that data. We've really only scratched the surface of what's possible within ClickSense. There's a lot of additional visualizations and also third-party visualizations available for anyone using it to download across the sort of Click community. We've used it in conjunction with some modelling that was performed in other packages as well to convey the results. So, for example, the Think Family Risk modelling that Becky mentioned earlier. The model was not produced in Click, but it's a great software for analysing and cross-filtering and drilling into those results. Click also, it allows integration with R. So if we wanted to, we could create an app that would dynamically analyse a data set. We haven't explored that yet in practice, but that functionality is in there.
Awesome. A world full of opportunities. Cool. So the next one was back to Carol. So did you look at what data was available regarding exploitation, e.g. NRM?
Yes, we did. But I'll expand on that. I won't just say yes. So NRM, for those of you who don't know, it's the National Referral Mechanism. And there has been a lot of work been going on in not just defining exploitation in the past few years, but there is a lot of work going on in terms of data and exploitations, work of Carleen Firmin, research in practice. There is also a major project going on. I think it's in Greater Manchester, the 10 Greater Manchester local areas. So there is, we did collect information from local authorities on exploitation, and it was one of those that fell below the pyramid because there was other work going on. Again, this is where local authorities and research, making sure we weren't duplicating what was already out there. But this is where being able to look and try and sort of like triangulate and pull this together is really important. So there were some clear messages from safeguarding pressures about the increase in exploitation and the impact of exploitation through to adulthood and transitional safeguarding as well. But it was, again, you think about it was just one of those things where there was too much that we could, something had to be left out of the report, and because of the other work that was going on with exploitation across the country, and the sort of like the data project on that, we thought, okay, so let's wheel that in a bit and not publish that as at the forefront as we would have liked to.
Wonderful. And while I've got you, the next question is also for you. So it was, what was the impact of safeguarding pressure research and analysis? i.e., has it changed government policies? Yeah,
obviously I would like to say yes, it has had lots of change, had lots of impact, and we know from when we first did it, we have actually been able to see that there has been impact in terms of policy, in terms of funding. We were delighted that one of the key findings from phase 6 was where local authorities unanimously were saying, if troubled families funding does not continue, we cannot run our early help services. If we cannot run our early help services, then our demand on social care is going to increase. And we were able to enumerate that and say what that meant, and in terms of the financial impact as well. So I would like to think that and the sort of like the evidence in phase 6 and again in phase 7 has helped to provide part of the business case about why supporting families now is needed. So local authorities, the evidence is there that local authorities absolutely see troubled families then, supporting families now, as a key part of their ability to keep children safe and to their well-being. We know that also there has been other influences, for example, the unaccompanied asylum seekers are talked about, and it's used by AADCS in their policy discussions with not just DFE, but with various bodies as well. Local authorities use it as part of their business case for retaining and improving children's services. So in terms of indirectly, I would like to say that there is the evidence there of the impact over the years.
Wonderful. Thank you very much. And thank you to all of today's presenters. That does bring us to the end. Remember that there are still a few days left in May, and so there are other events happening as part of Analysis and Government Month, and I've dropped the link to the Eventbrite in the chat for you to check out those other events.